Thank you, the Hindi team. Good evening, good afternoon, and good morning. This is the 2141st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Sivaramakrishnan. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and from 8:30 to 9:30 we have the international session in English, and from 9:30 to 10:30 we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again and subscribe the same without paying any money. And you can share it with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world. Let me come to today's guest. As you all know, today our guest is Dr. G. Sivaramakrishnan. Sir has completed MA and DHMS, and he's a retired DMO from Department of Homeopathy, Government of Kerala, and retired district medical officer and former assistant professor. At White Memorial Homeopathic Medical College, Attu, Tamil Nadu, currently practicing at Dr. Sivaramakrishnan Homeopathy Clinic at Kirur, Irati, Kannur, and devoting his time to serve the public and community welfare initiatives, and has over 40 years of clinical experience in homeopathic medicines, and also a talented singer. You can watch some of his videos in YouTube as well as Facebook. Those who enjoy music and really, he's an exciting person. Along with his wife, has promoted so many songs in Facebook. And sir is one of the most wanted faculties in Kerala in most of our classes. And today, doctor is talking about atopic dermatitis and homeopathic management. We welcome to this session. Welcome, sir.
Thank you, Dr. Tanesh, for giving me the opportunity again. Let us go with the topic. With your permission?
Yes.
Okay, sir. Okay, sir. Thank you very much. Today we are going to talk about atopic dermatitis as well as known as allergic dermatitis, eczema. We need not go to the details of the disease because we are all doctors. The root cause and everything, the hereditary factors and triggering factors well known to us. So simply, in my practice, 40 years of practice, what are the medicines given by me? What are the methods I follow? That only I am going to tell you. There may be controversial opinions. Dr. Sivaramakrishnan using 3 to 4 medicines at a time, and at the same time he is not at all a homeopathic prescription. Definitely, that is not like that. I'm a pure homeopathic prescriber. Whenever I give a medicine, there will be definitely homeopathy definitely will be there. So without the prescribing module, we cannot prescribe anything. Actually, we have learned a lot by our Materia Medica and from our teachers, from our pioneers, from as well as our experienced doctors. We have learned a lot. But at the same time, some of the things we have to precise. What are the medicines is highly indicated for allergic dermatitis or atopic dermatitis and as well as eczema. So not only eczema and as well as sometimes I may deviate with other skin diseases we are facing every day. So I am quite comfort with very few medicines regarding curing atopic dermatitis. Atopic dermatitis is 100%. It is, we know very well, that is a hereditary factor in behind. And children after birth, 6 months of age, they will develop the same. There will be dryness of skin, and there will be itching, intense itching, scratch after scratches, oozing. Sometimes may not be oozing, whether it is oozing or may not be oozing, but whichever it may be. Our medicines are very promising. In my 40 years of practice, I have used above 30 years back. I just practiced, I just experimented many medicines, especially whenever skin breaks, there will be oozing honey-like discharges. Immediately in our minds, graphitis comes. But in the olden days, 30 years back, I have used graphitis 200. There was severe aggravation. The patient cannot tolerate, and patient definitely quit from our clinic, and they will be they will be asking the help of other medicines, other kinds of medicines, and the doctors usually denote the same condition as medicamentosa, that is aggravation of homeopathic medicine, and they will treat accordingly. So, for above, all these, everything is considered. And after long years of experimentation, I just raised my potency into 200 to 1M, and afterwards 10M and 50M. Now, since 30 years, and since 35, okay, about 25 to 27 years, I am using graphitis CM potency. Very safe. There may be aggravation. Definitely, we have to educate the patient. Whenever we give graphitis CM, I used to give 3 doses. That's my convenient dose. Usually, I start the dose CM potency today morning, today evening, tomorrow morning, and tomorrow afternoon. Afterwards, and 10 years back, I just used the same. There was severe aggravation, and patient definitely quit from our clinic, and they have sought the help of other practice of medicines. And I came to understand there was severe aggravation. So arsenicum should be followed by graphitis. So arsenicum is an antidote to graphitis and as well as following. We have studied in our classes. So put into practice, I practiced after giving 3 doses of graphitis CM. Then very next day evening, I just started giving arsenicum CM. Very well known to us. That means hot application gives amelioration, dark color and everything. Whenever we search our repertory, 5 marks are given for a dark colored. And scratches are there. Hot application relief, everything we know very well. I used to follow arsenicum CM the very next day evening, and the next day morning and afternoon. So consecutive 6 doses comprising of these 6 doses as graphitis today evening, tomorrow morning, and tomorrow afternoon. Then the next tomorrow evening, arsenicum CM, and the next day, arsenicum CM again and afternoon. These 6 doses do miracles. In my practice, I'm saying, and every homeo doctor, definitely you just put into your practice. Whenever everybody having their own methods, their own knowledge, their own methods are there in behind. I'm not compelling, but I'm very promised to advocate applying these medicines. Along with that, in my practice only, I'm telling, I used to give Rustox 30th potency. Along with that, so I won't give arsenicum and graphitis. At the same time, only placebos are there for 2 days. After 2 days, after the 6 doses are over, I advise I give the patients Rustox 30. Rustox definitely some of the doctors definitely they won't think about what's a indication of Rustox in skin diseases. Definitely, you just whenever we go through the Materia Medica, Rustox is a very important medicine for skin rashes and blisters, and as well as hot application gives amelioration, and as well as intense itching. Rustox is there. Rustox indications are there. So along with that, after 6 doses are completed, I used to give rest of 30 for a consecutive 7 to 10 days. Along with that, another anti-inflammatory medicines are with us. Inflammatory medicine is with us. Medicines are there. In my practice, I used to give Kali muriaticum. That way, whenever we go through the repertoire and everything, it is very well mentioned. Anti-inflammatory active properties are there. Anti-inflammatory, we need not use the word. At the same time, there will be swelling, inflammation, and burning, and everything will be there. So swelling also. So Kalimur, 6x I used to give. Within these 4 medicines, planned hundreds of cases I have cured. In my practice, I am telling. Anybody having different opinion, you can ask me, and we'll talk and we'll discuss the matters in detail. And even psoriasis also. Psoriasis, we know there are three types of psoriasis: mild, moderate, and severe. Mild cases, definitely, out of 10 cases, we can cure 8 cases. And in my experience, I'm telling, the same method I am following there also. That the psoriasis case also. Whichever may be the skin condition, whether it is psoriasis or whether it is atopic dermatitis or allergic dermatitis, and as well as eczema and any other fungal infections also. Tinea versicolor, not tinea versicolor. There is no. We need not expect any oozing. Tinea, other tinea infections. Tinea infections are there. Tinea cruris, tinea capitis. Sometimes there may be oozing. So such cases, the same method I usually follow. It is very convinced, and about my five internees. Well, whenever I work in the government hospital, government homeo dispensary, my 5 internees they are using, and they have also verified the same. But there will be aggravation. Definitely we have to tell the matter to the patients. There will be 3rd day. So the patients are convinced, and I am very much convinced about that. 3rd day there will be small aggravation. So without giving arsenicum, the aggravation will be very big, and the patient cannot tolerate the same, and the patient definitely will run from our clinic. At the same time, arsenicum will pacify the aggravation. At the same time, it will complete the cure also. So 3rd day, I used to tell the patient, 3rd day there will be aggravation. You have to tolerate, and after 7 days there will be amelioration. So hundreds of cases are verified. Sometimes the number 3, sometimes maybe 6 or 3, 4, 5 like that. Anyway, within 10 days there will be aggravation. So I used to tell our patients, so our homeopathy medicines are just like atom bombs. Whenever there's an indication, whenever we give another medicine, so whichever may be the medicine that is not at all indicated with the same condition, then how can we expect an aggravation? Expect an aggravation there. So our medicines are producing aggravation, means the medicine is acting. Medicine's role is there. Medicine is acting there. So far it is concerned. So I am actually very much astonished about our practice. That much experiences everybody of us are having such experiences. 3rd day, usually I tell the patient, you can expect an aggravation on 3rd day, and there will be amelioration. Don't worry about it. It won't be disturbing you, and there will be amelioration of the complaints after 7 days. And again, some of the cases after 15 days, 10 days medicine or 15 days medicine I used to give. After 15 days, at same time, same aggravation, slight after amelioration, there may be slight relapse of the symptoms, itching and oozing, slight, very in a very small extent it may develop further. So again, the second, whenever the appearance of the symptoms, second time it won't be severe type. There will be some small type of it will be in a controlled manner, and we can easily alleviate the symptoms of the patients. The second, whenever after 15 days, if any it is needed, whenever it is needed, again I will repeat the same. So the aggravation will be only in the first time. At the same time, after 1 year, if there is any relapse, If we use the same medicine, there may be aggravation we can expect as whenever the first time, as like the first time. But after 15 days, there won't be any severe aggravation, small aggravation, some extent of aggravation may be there. The same gravity CM, 3 doses, as I mentioned earlier, and followed by azanicam. There will be pacification pacification of the symptoms, and the patient will be very much satisfied. And such a manner, I will continue the treatment for 3 to 4 months or maximum 6 months. Some of the patients may be having the same illness years together. Atopic dermatitis, we know, as of up to 12 years of age, the children will be suffering. So we can cure within 6 months. But at the same time, earlier classes I have mentioned, I will try to find out the exact constitution of the patient or child. Most of the cases, calcare carb will be leading in the case of children. So alongside, whenever you are using graphitis 3 doses, arsenicum 3 doses, consecutive 6 doses like that, Rustox 30 for consecutive 2 days, 20 days, and Calimur 6x the same 2 weeks or 20 days. Along with that, every 10 days, the constitution, if permits, I will give calcare carb. So very important medicine. Whichever may be the condition of the skin disease, having redness, itching, swelling, and as well as the symptoms of hot and everything, acute inflammatory manifestations are there. Definitely, the indication goes to belladonna. That we know very well about it. So belladonna is a chronic is calcare carb. So calcare carb only I will finish the cure by means of giving calcare carb 1 to cm along all through the 6 months, and will finish the case by giving calcare carb cm. So in this manner, I am very much convinced, and I am curing many hundreds of cases I have cured. Atopic dermatitis is very difficult to doctors, even though homeopathy doctors, Ayurveda doctors, and as well as allopathy doctors, every branches of science, doctors are suffering a lot regarding atopic dermatitis. I use the same formula. I follow the same formula, atopic dermatitis also. But some of the cases were dry lesions. These are all, we have talked about the lesions, dry, not dry, oozing, the thick honey-like discharge. Whenever we study honey-like discharges, so just after scratch, definitely we can expect oozing fluid. So indications are there. Graphitis indications are there. Arsenicum will pacify, and it will complete the cure. So along with calcare carb, I already mentioned, Rustox and Calimur. So atopic dermatitis, some of the cases, the very beginning, there may be dry lesions. There won't be any oozing. Such cases, definitely, there may be redness. Belladonna indications are there. Belladonna, whenever we think about belladonna, plethoricity should be there, and redness, and the first stage of inflammation, dolor, color, already we have studied everything. That type of, we think. At the same time, belladonna is very important whenever an aggravation comes regarding this type of, whenever we give medicine for itchy lesions and allergic dermatitis. Whenever aggravation starts, we have to give belladonna, Apis mellifica, Calimur 6x, and such medicines are very much helpful. So at the same time, we have to be very careful whenever we treat such cases, especially atopic dermatitis or allergic dermatitis, eczema, even pyoderma. Especially in the case of pyoderma, there are chances for AGN, acute glomerular nephritis. Modern medicine people, whenever a patient come to us after giving our medicine, pyoderma, especially pyoderma, is actually staphylococcal infection. Staphylococcus. So in the scabies also. Scabies starts with the scabies, and secondary infection with the bacterial infection. Staphylococcus or streptococcal infection, especially staphylococcus, there will be severe aggravation, and oozing of pus will be there. And there may be some of the cases we have to be very careful, very caution about AGN, acute glomerular nephritis. Such cases, definitely puffy face will be there, and their bag like swelling beneath the eyes will be there. And such cases, we have to be very careful in order to prevent, AGN, acute glomerular nephritis. I used to give Mepsol 1 3 doses, today night, tomorrow morning, tomorrow afternoon. So whichever may be the case of hypertension, I used to give three doses, consecutive 3 doses. So Mepsol will prevent that. In my experience, I'm telling. Definitely, whenever we go through the documents, go through our books, we can find out the reason in which manner it occurs. Such cases, I'm telling about, I'm just come to the point of atopic dermatitis. If it is a dry lesion, I used to give anti-crude. Anti-crude is very important, we know. It's a very thick, very dry, scaly eruptions will be there. Bacillum also, there may be indication. Bacillum indicated, and anti-crude is a very much indicated. Anti-crude is a deep acting remedy. So we cannot give frequent doses. Belladonna, we can give frequent doses. Guanine, we can give frequent doses. And such a short-acting remedies we can give quite often. At the same time, anti-crude is a very deep acting. Anti-crude, the constitution, so anti-crude is a constitution remedy. So, in the case of anti-crude, I used to give 15 doses, 15 doses, consecutive 15 doses. So I'm satisfied with the consecutive at least 9 or 15 doses or 3 doses like that. Hypertension is 3 doses. I won't give a single dose because I already I have mentioned in the earlier Malayalam webinars. The exact, if you are able to find out the exact similar remedy, definitely 1 dose is enough and more. No doubt about it. That's our homeopathy will be there. Homeopathy is there. If you are able to find out the exact similum, not most similum, exact similum, if we are able to find out, 1 dose is enough and more. The cure will be established within hours in the case of an acute disease, and in the case of chronic disease, within days we can expect cure. But actually, we happen to expect most similum cases, and somewhat similar, partially similar. And in such cases are where actually we can get, we usually get such cases. So 1 dose is not enough. Consecutive doses is needed. So think about our drug proving. At the time of drug proving, we used to give, we didn't give 1 dose. At the time of drug proving, we used to give consecutive doses. Doses at the daily TDS, 3 times doses for consecutive 7 days or 10 days to different constitutions. Children we used to give, and different types of constitutions, and male, female, and different age groups. And such a manner we have recorded the symptoms. We have collected the symptoms from the patients, and finally it is recorded in the Materia Medica. That is drug proving. So within but at the same time, idiosyncratic patients, definitely 1 dose is enough. Definitely, we can expect that. Most of our medicines in the toxicology, strychnine, we need not go for any experiment with any drug proving. It is recorded. Strychnine poison, like so. Poison symptoms are there. Just like arsenicum. We need to go for any experimentation, drug proving for in order to collect the symptoms of arsenicum. Already it is in the toxicology. So the toxicological symptoms of most of the poisons are recorded in the Materia Medica. As such, it is given the toxicological symptoms. But at the same time, we cannot get the symptoms within a single dose. Consecutive doses we are giving for drug proving. Just like that, the patients are coming with us, and we are giving consecutive doses. Nothing wrong with that. So in such a manner, we can treat. And come to the atopic dermatitis, allergic dermatitis, and actually it is inherited. We know very well, and it's genetic, and the triggers are there. Only triggers. The triggers actually from food. Only 30% people will be getting triggers by means of food. and other environmental materials and ACD, allergic contact dermatitis, contacts are there. We are using many materials, even gold, other metals, and cosmetics, even sunlight, and many other environmental factors are there in behind. So that comes around 70%, only 30% from food. So most of the doctors give restrictions. Don't give egg, don't give fish, don't give seafood, don't give meat. Nothing doing that. I won't give any advice to the patients. We don't know which food is disagreeable to the patient. How can we come to the conclusion about a particular food that is disagreeable to the patient? How can we know? The mother or the father sometimes may be knowing such and such a food. Egg is very safe. Egg is very safe. There is nothing wrong with giving egg. Eggs are very highly nutritious, we know. All the ingredients of nutrition are there. Vitamin A, B, C is not there. D, E, K, and choline, selenium, calcium, rich in calcium. Protein is there. And I don't give any advice to the patient to restrict some of the food. Actually, that should be convinced by the mother. Whenever giving such and such a food that is disagreeable, that only the mother knows. We are sitting in the chair, and how can we, without knowing the details of the disagreeable things to the child, how can we advise? How can give a list? How can we give a list of dietary material, dietary contents? Don't advise to avoid. So that is not actually in my case. What are the things disagreeable? What are the highly sensitive to the particular patient, particular child or patient? That they have to experience. They have to study. They have to watch and everything, and come to the conclusion about the disagreeability. So come to the medicine. In the case of psoriasis, already I mentioned. Psoriasis about the mild, moderate, severe. Psoriasis, I used to give the same method. Graphitism, arsenic Rustux, and as well as Calimur 6X. So, some of the Sorinum 1 intercurrently I used to give. And even Calcaricar, if the constitution permits, I give Calcaricar. If the constitution permits Lacasis, I give Lacasis intercurrently. So, within a single medicine, I'm not using say single medicine. I'm a staunch follower of homeopathy, and used to give homeopathy medicines only. But I have the privilege and I have the experience to give 2 or 3 medicines. So nothing wrong with that. Anybody ridicule me, people may ridicule. People can ridicule. That their own privilege. But I am getting results. I'm getting patients out of this. That's I'm convinced about that. So some of the medicines, each and every medicine, it will act its own way. Its own way. Nothing. There will be any clash. We are not mixing the medicines. We are not mixing. So just giving just gap or a 10 minutes or 15 minutes gap, we are giving medicine, and it will act accordingly. So if the again I am telling, if we are able to find out the exact minimum single dose is enough, so most of the time we are not at all selecting the same. And in the case of urticaria, that's a related topic. Urticaria is very easy to cure. Very easy to cure. The people, modern medicine people, are very much struggling to cure this urticaria. There are pressure urticaria is there. No, normal urticaria. Urticaria, whenever pressure urticaria, whenever scratches, there will be the impressions are there in the skin. So urticaria, I am using simple. There is no oozing. There's no indication for graphitis or arsenicum. There is indication, clear-cut indication for Apis mellifica, clear-cut indication for belladonna, clear-cut indication for Calcarica, intercurrent remedy. So after the acute phases are over, I used to give Calcarica. It's a very important medicine. And without Calcarica, I cannot treat my patients. I cannot think skin diseases. Calcarica is very important. Already one of the bronchial cases, webinar, I repeated the same. Calcarica is a very It's a treasure for us. Calcarea carb is a treasure medicine, no doubt about it. Most of the cases, even not only bronchial asthma, and as well as allergic dermatitis, allergic asthma, and allergic bronchitis, and as well as allergic rhinitis. These are atopic. That totally we altogether we call them as atopic. Allergic rhinitis, allergic dermatitis, and atopic dermatitis, eczema is atopic. So for such cases, the constitution should permit. So very thin, lean, conjunctive patients, how can we give? How can we indicate calcarea? So we can find out another remedy suitable to that constitution. Calcarea, if the constitution permits, calcarea will do good, do excellent results. Come to the this urticaria, pressure urticaria or urticaria. There will be no oozing. Only there will be wheel formation. Redness will be there. Belladonna, I told you already, and apis, and calimur. I don't forget calimur. Calimur 6x. Rustrox, maybe I shall give Rustrox. And Arsenicum album. There may the atopic dermatitis, I told Arsenicum CM. For such cases of urticaria, Arsenicum album, 15 doses I used to give. Morning and evening, or consecutive 3 doses every day, or TDS into 15 doses for 5 days. It will giving results along with the belladonna apis. And after some time, the urticaria, we know after 2 hours everything will be over, and again there will be relapses. Daily relapses are there, and weekly relapses are there. And triggering factors, whenever they are exposed with the triggering factors, there will be relapses. So such cases, whenever a standstill comes, I use the intercurrent remedy or constitutional remedy. Calcarea usually indicates. The condition is the constitution should permit. Like I says, maybe in the case of climatic ailments, climatic patients, very hurried and worried and very hot, and they cannot tolerate tight clothing and menstrual irregularities and everything. And definitely we can menstrual it is very regular in the case of lacusis, we know, but other symptoms will be there. Hot flushes all over the body, and hurried and worried, and there will be even such a case of depression also. Some of the lacusis patients, they feel depression. So I used to give lacusis to such patients. We cannot think about calcarea. So calcarea. So in the case of urticaria, along with this medicine, I used to give Urtica urens and as well as Echinacea tincture. Urtica urens tincture, Echinacea tincture, both mixed 10 drops into together 20 drops, 2 days, 2 times daily for consecutive 10 days or 15 days. That gives good results. To me, I'm convinced. I'm telling about my practice only. We can definitely deal with these medicines for urticaria and as well as atopic dermatitis, allergic dermatitis, eczema, and psoriasis like that. Psoriasis, for fulminant type of psoriasis, and the grade 3, that means mild, moderate, severe. Severe cases we cannot do anything. There, the patient, the condition is like that. Only we can give some palliation. Just like palliation, not palliation. We don't use the word palliation. We can give only amelioration by giving some of the medicines, indicated remedies. So soranum and as well as basilinum and anticrot and calcarea floor medicines are there. Even calcarea, then calcarea sulf and calimur 6x. With these medicines, we can deal the patient, and soranum 1, soranum CM, soranum 10. Currently I used to give, but at the same time, fulminant type is very difficult to cure. But a moderate type, there will be lucid interval. Most of the quacks, they claim after giving some of the medicines, they claim results. So there, in the case of moderate case of psoriasis, there will be lucid interval. Well, whoever may be the medical practitioner, there will be lucid interval. There will be the symptoms. The skin will be come to the normal texture and everything, and everything will be vanished after 3 to 4 months. And the people or the particular practitioner claim that this medicine has done well, and okay. And after the lucid interval is over, again it relapses. And years after, the patient will be knowing that only is a lucid interval, it is not cured. So first of all, particular not a medical the quackery doctors, they claim after giving the medicine, after giving their medicine, it is over. Yes, everything it is cured. But the patient will be propagating the same to some of the doctors, some of the patients having the same illness, and the patients, the doctor, the particular quack doctor will be getting patients. So I'm not blaming the quackery, but at the same time, it is everybody will be enjoying the lucid interval. So whenever we give medicines at the time of lucid interval period, automatically it will be going, and after some time again it will be relapses. So a lucid interval will be there in the case of a moderate case of psoriasis. In my case, there will be intense itching, in the voluptuous itching will be there, and oozing blood, and as well as sticky fluid. The graphite CM and the arsenic CM I am using. I'm convincing. Just my friends, you just whenever the doctors, you just you hear my words. You just put it to practice. If you fail only, definitely you call me. I'm very much convinced. Unnecessarily, I'm not telling. I'm not imposing. But in my practice, but there will be aggravation. There will be aggravation. But whenever if we don't use arsenicum, the aggravation will be very severe, and the patient cannot tolerate. So lower potencies, there will be aggravation. Severe aggravations will be there. Higher potencies, especially CM, the aggravation will be very much limited, and we can manage with other medicines. But very careful. The aggravation whenever comes, there will be swelling, and watch the patient, and we have to instruct the patient any change in the face, any puffiness in the face, any bag-like swelling under the eyelids, lower eyelid, go through urine routine, and we have to find out any albumin in the urine, and again we have to check the BP of the patient. Even children also, BP will be very high. Acute glomerular nephritis. We have to be very careful, and we have to watch the patient whenever at the time of aggravation. The people, modern medicine people, ridiculous. Also, medicament also. They are giving some of the medicine that's aggravation. The aggravation started. So only we can manage that. So we have to be very careful. Such cases in advance, we can give Mepsol 1 3 doses. Intercurrently we can give. It will prevent that type of AGN, acute glomerular nephritis. Come to the other conditions, other skin conditions. Just rashes. Just a simple rash. Simple rash means miliaria and other type of acute some insect bites, especially scabies. Scabies, definitely we can, in the case of scabies, with there will be furrows in between fingers, in that case also, I used to give graphitis as the same method I'm following, along with Rostox, caliber 6.6. And at the time of aggravation, belladonna, not belladonna, sometimes belladonna may be indicated, and arsenicum, Apis, caliber 6.6, like medicines I used to give, and I will control the aggravation in such a manner. And maybe very safely repeated every 15 days. And whenever there is amelioration, what's the need of repeating the same? Whenever it is needed, I used to give after 1 month or 2 months. Up to that, I will give placebo. I will give some of the medicines like Calimor, Natros. The phosphates are very important. 5 phosphates. In my practice, I used to give 5 phosphates. Different illnesses. In the case of skin, we can definitely all the 5 phosphates are indicated as per the indications. As per the homeopathy, it should be there. There will be inflammation and swelling, Calimor and ferrophos. Calcareophos is indicated for some other conditions, so calcium deficiency, and as well as the dry skin like that, we can give calcareophos. And ferrophos whenever patients are tired and any anemia situations, definitely we can manage with the Pyramphos, Magphos. Very important. At the time of aggravation of skin conditions, I used to give Magphos. Magphos, the symptom after application of cold hot water, the patient gets relief. So Magphos indications are there. So along with that, whenever aggravation comes, Magphos, 5 phases. I used to give 6x potencies for therapeutic use, for supplementary purposes. For example, if a patient needs calcium, why can't along with that, if the patient is the child is a calcary carbo patient, I give calcary carbo 1 along with that. Sometimes fever comes, Belladonna, we will manage with the Belladonna acutes. In that particular acute, we will manage. Along with that, I used to give calcium carbonate, calcaric 3x. Elemental dose should be there. Elemental calcium for osteoporosis cases and children having sweating, severe sweating, and the child cannot wear clothes and always need cold air, and that type of feet are cold and head is very much hot, intense sweating and craving for eggs. We know the symptoms of calcarica. The constitution itself reveals. So such cases, along with the calcarica 1, I used to give calcarica 3x. Elemental calcium should be supplemented. And what's the need of 6x or above? It won't be working. So 1 will work. 1 or hypotension will work in such a way. So homeopathy will be there. Along with that, calcium carbonate should be supplemented. Calcium, we shall advise eating eggs and calcium content food. Definitely we will advise. Along with that, calcaric of 3x. I used to give calcaric carb 3x. Calcaric of 3x is available. I won't use calcaric with 6x. Calcaric 4, 6x, I used to give dry skin and other skin conditions. So 5 phos, calcaric phos and Magphos, Pyramphos, and other 2 phoses. Very, very important for dealing skin ailments. Now the time is 9:13. Only 17 minutes are in behind.
Yes.
And yes, any doubts regarding? Anyway,
Yes.
doubts definitely please raise doubts. And at the same
Yes,
time, don't give any lectures, because some of the doctors they start giving lectures. But only doubts, please ask me. Okay.
Yes. If you want to continue for 5 minutes, you can go ahead. Then we can answer.
Definitely. Some of the cases, dry skin. Most of us usually use sulfur. Sulfur, I am very much afraid of using sulfur. Sulfur, whichever may be the instances, I use sulfur. There, I face aggravations. I very rarely I use sulfur. Sulfur indications are there. Okay, if the indications is very particular, in 100% indications are there, homeopathy is there, I use sulfur. But most of the cases, I avoid sulfur. But at the same time, graphitis, arsenicum, Calimor 6x, and Rustox. Rustox is very important skin remedy. Most of the doctors not thinking about Rustox. You just go through the therapeutics, go through the books. Whenever I come to a CME or come to a webinar, I won't refer any books. Only I used to tell the matters in my practice only. If I am accustomed with any books, I will be prejudiced. I won't refer any books. Only in my practice only I used to impart the ideas and everything. So shortcuts, we won't allow shortcuts for the beginners. Beginners definitely they have to search. They have to learn a lot from pioneers. They have to learn a lot from our books. They have to learn everywhere. Learn from everywhere. But we people, just I'm the age of 63, practicing homeopathy since 40 years. So I just I come to the conclusion about some of the medicines, in which condition, which of the medicines are most suitable. And such a way, I'm convinced by practice, I'm giving medicines and patients are satisfied. If we are able to give our 80% cases, at least 75 to 80, we are successful practitioners. We are very much, we can proud of us, proud of our system. It's a great one. Now, some of the patients within already, some of the classes I mentioned about the migraine, right side, sanguinaria, can, and naxomica. Every 5 minutes, 3 doses, consecutive 6 doses, alternatively. 30 minutes, the patient, I will sit the patient outside. After taking this medicine, you just report me and tell me about the results, and you can go afterwards. That much convinced. Such cases, our homeopathy medicines are, it's a great one. We know, we are highly convinced the cure establishes. So actually, people, other systems, people, doctors ridicule us. Everything is everything is automatically the body cures. Definitely, body cures. We are supporting. We are supporting only allopathy, ayurveda, homeopathy, everywhere. Body is the main factor. Our system is the main factor to cure. We are supporting the same. Antibiotics are supporting. Antibiotics are directly killing the microorganisms. We are strengthening our body. We are strengthening our vital force. We are believing our vital force theory. And our immune system. Immune system definitely will fight against such diseases. Our homeopathy, similia similibus curanda, and like cures likes. Our we know the aphorisms of our Morganan. The cure establishes like that only. We are convinced. We are not most of the, all the homeopathy doctors, we are all convinced about our practice. Our medicines are just like atom bombs. Third day, I just you tell your patient after giving Graphitis CM, Asanicum CM, Graphitis CM 3 doses. After 3 days, there will be aggravation. With that, but third day we can say. Third day. But we have to manage. Aggravation comes, we have to be very careful about the agent, already I told you. And other situations, whenever aggravation comes, we will be able to alleviate the symptom. We will be able to keep the patients with us, and we have to manage. We'll be able to manage in such a manner. Very rarely, some of the cases we can we will be compelling to send the patient to the expert doctors. Some of the very rare cases, some agent develops. Very rarely it will develop. Very rarely. So there will be pus formation, secondary infection. If there is secondary infection, especially cephalococcal infection, there are chances. Very rare cases that we can very careful by means of a careful prescription. Already I told you about the Mersol. Definitely there won't be any such aggravation. The past days, the very beginning, whenever I practice in the very beginning, I experience these type of aggravations and this type of medicamentosa. We can manage now very easily. So by means of practice, we can come to we will be accustomed with dealing the patients in such a manner. Anyway, these are the things about eczema and some of the cases for hair fall. There may be tinea capitis, tinea cruris, like that, tinea infection. In any oozing the scalp, there also, in that case also, I used to give graphitis. The same thing I used to follow. The same thing. Along with that, after the acute phase is over, scabs are there, and there will be dandruff. We can advise the patient, rub the scalp with our arnicated oil every day morning, 5 to 10 minutes. Gentle massage we have to advise, and scalp massage is very important. And 50%, our advice is very important. Only 50% the medicine will act. The remaining 50% means we have to address, and we have to address the maintaining cause. We have to advise the patient. There should be, the patient should sleep well, and there will be lifestyle modification, diet and everything. We have to tell the patient about their dietary matters and their walks of life, everyday, day-to-day life. They have how to maintain everything. We have to advise. So whenever we deal patients in such a manner, not only giving medicines, giving advices. So the patients will be with us. Patients will be convinced with our treatment, and they will be with us, and will be do miracles. We will be doing miracles. In the case of dandruff and hair fall, nowadays all the doctors, including we people, we are also scientifically we have studied, just like modern medicine doctors, and we know the causes in behind. Definitely, we will go through D3 hydroxy, D3, vitamin D3, any deficiency there, and thyroid function test will be going, any ferrum, any iron deficiency, and as well as such a manner we will be find out the root cause, and along with our medicine we have to supplement that also. We have the vitamins and minerals we have to supplement. There is nothing compromise with that. So not our medicine definitely will do miracles, and we have to give supplementation. If there is any thyroid deficiency, there are chances for falling of hair fall. We have to deal. So basilinum vonnam, I used to give basilinum vonnam 3 doses today night, tomorrow morning, tomorrow afternoon, and along with that, sepia. Sepia is very important medicine for dry scaly eruptions. Sepia is a deep acting remedy. Sepia 200 or limited doses I used to give. Natramur also, Natramur 6x. In the case of hair fall or dandruff, I used to give gentle massage with our ornicated oil. Along with that, basilinum vonnam 3 doses. Today morning, tomorrow morning, and today night, tomorrow morning, tomorrow afternoon. And sepia, a few doses. Natramur 6x. For therapeutic purpose, 6x. Supplementary purpose, I used to give 3x. Therapeutic purpose, 6x and above. 6x. And Bediaga 200. Very important. Bediaga 200 for hair fall. So there may be tinea capitis. Tinea cruris also. We can, tinea cruris, there will be oozing. If the scalp also, the dry lesions only, I mentioned these drugs. If any oozing, definitely I will follow Graphite-CM, Arsenicum-CM. We have to face the aggravations. Some of the cases, very severe, long standing means 10 years or 15 years or 30 years of eczema cases or allergic dermatitis, atopic dermatitis. Definitely, I used to repeat the same Graphite-CM, Arsenicum, 6 months, 10 to 15 days, 15 times, without anything wrong with that. Nothing doing. There may be relapses. Again, relapses may be there. But consider 30 years, the patient is suffering. So it may be needed about 10 times in the period of 1 year. I may repeat quite often. Not often. At least 15 days interval should be there. Whenever the symptoms are alleviated, at the time, if we give Graphite, there will be severe aggravation. So whenever it is aggravation, at the time of aggravation only, again I will use Graphite-CM, Arsenicum-CM. Arsenicum-CM should be followed. In my case only, I am telling, and doctors having that type of their own methods of practice is there, and I am not at all compelling anybody to follow this. And when you are convinced cases, your methods you can follow, and your failure cases only, you just put into practice this method. It's a very tremendous one. I am getting patients out of this. Patients are coming from everywhere, from many different places for eczema. Already I made an interview at Asianet Doctor Life for 15 years back. Thousands of people watched that Asianet video. Asianet, it is still there. Eczema homeopathy treatment, I think, they're getting. The people are coming from different places, from even abroad. Abroad means that type of patients I'm getting, I am using the same method of treatment, Graphite-CM, Arsenicum. I do wonders. I'm very much convinced. I'm telling the same to you. Thank you very much for giving me the opportunity. Once again, for third time, the international session. It's a great opportunity for me to have a session, the international session. Thank you, Dr. Danesh, for again inviting me for interacting with you. Thank you very much. Any doubts? If you please, you can ask me.
Yes, sir. It's really a very good session, and you really come out what you are really, because you never hide anything inside your body or in your mind. You just came out openly and uh, suggested what are the things to do and how we are giving medicine and what are the things. Sir, you have not mentioned about diet and regimen and whether what are the things you advise to the people who are having skin problems. This is the only question I would like to ask.
Yeah, definitely. I just mentioned short while. I just mentioned about that. I don't give any restrictions. So actually, we know there are triggers. Triggers come with not only with the food, many other external environmental factors are there. Contacts, ACD, allergic contact dermatitis. So these are only triggers. The basic reason is in behind that is a hereditary, that is a inherited. So most of the 90 or even we can say 95% of cases of eczema or allergic dermatitis, atopic dermatitis, that is the inherited one. And either parents will be might be having and siblings like that. So we can I used to advise a patient, you just watch. Only the protein diet will be sensitive. Protein diet means cereals and pulses, nuts and meat, fish and sea fish and the eggs. And definitely we won't blame eggs. Only 2% of the people having sensitive with eggs. Yesterday, 2 days before, yesterday, I just in the Facebook, I mentioned in Malayalam about the good qualities of eggs. Where most of the people they are misunderstood about the using of eggs. Eggs are it's a great treasure, no doubt about it. And if the particular patient is very much convinced about the whenever using such and such articles, especially protein diet we know protein. Only there are chances for sensitivity in the protein while whenever using protein. When I mentioned some of the food. So if the patients and bystanders are convinced about using that type of food, they have to avoid. So we can't give any list. We can't give. One thing I usually strongly I advise: don't take dry fish. Dry fish, the very beginning itself, I advise the patient not to take dry fish. And in the case of eczema and otherwise, don't take, especially pork and as well as beef like that. Red meat they have to avoid. I used to tell the patient because some of the cases they are along these years, the patients are telling about after using this type of red meat, they get aggravated. So only for that cases, these type of restrictions I usually tell the patients. Otherwise, they have to find out. They have to find out the triggers. We cannot we are sitting in the chair and giving a list. Don't take such and such food. How can we say? That is only up to the patient. Up to the patient. The sensitivity differ from patient to patient. It should not be generalized. Should not be generalized.
Okay. Very good answer, sir. That's what we homeopath need to do, and that kind of advice need to be given. I'm inviting Dr. Ambarish sir to say vote of thanks to the session. You can also.
Thank you, Dr. Dhanesh ji. Anyone, namaskar and congratulations, Dr. Sivaramakrishnan sir. Very good. Describe the atopic dermatitis and eczema, and very good describe the advice, selection of potency, aggravation, according to law of hearing. So, very thanks, Dr. Sivaramakrishnan sir. Again, presentation behalf of IFPH whole team. Very thanks. Thank you, Dr. Dunham. डॉक्टर डनहम का एक है कहावत की यदि सिलेक्शन ऑफ रेमेडी अकॉर्डिंग टू कॉन्स्टिट्यूशनल अकॉर्डिंग टू मैथमेटिक देते हैं तो हायर पोटेंसी छोड़ी गई बंदूक के गोली के समान है, निशाना लगा तो बीमारी गया और यदि निशाना चुका कोई बात नहीं. वेरी थैंक्स सर. Thank you.
Thank you. Thank you very much. Thank you very much.
Gargar
Thank you.
homeopathy, Gargar homeopathy. Thank you.
Thank you, Dr. Ram, Professor, and those who are in the English session, and especially and congratulations, and hope Dr. Sivaramakrishnan sir will come with some more presentation in the future. We are waiting for the same. Thank you all for joining the session, and thank you once again, Dr. Sivaramakrishnan sir.
Thank you, Dr. Dinesh. Thank you very much. I'm really indebted to you.
Yes, sir. Thank you. No, sir. It's up to homeopathy. We are all indebted to homeopathy.
Yes. Okay, sir.
Tomorrow we will have a session from Dr. Nirav Ganatra. He's working as the Associate Professor, Department of Organon of Medicine, and we'll be talking about management of monsoon maladies with holistic homeopathic remedies. Hope all of you will join also at the same time. Thank you all. Good night.
Good night.
Over to Dr. P. Shaila to moderate the Malayalam session.